bring out a sword.
Okay.
Euthanasia, the word from Greek, means easy death. There are many people who don't agree with euthanasia, and they think euthanasia is murder or suicide. And they also are talking about dignity of man or sanctity of life. Sanctity of life. Many people are suffering without any possibilities or treatments to get healed. For example, there's one person who can breathe, move, talk, what was worse, regulate the body temperature by himself. And through the respirator, make the illusion that life is expanding. Life is nobleness, so expanding one's life will help the person who is in pain to get one more chance to get healed. But if not, the person is breathing in so much pain without moving or talking. That is what objectors think about euthanasia. Of course, there are some different opinions too. But I think people have right to live their own life as human beings. In their rights, happiness and avoiding sufferers included too. If a person chose to live and suffer, that is an exception. But a patient who lives and suffers from disease or an accident needs to have right to deny the expansion of life with verified possibilities to get healed. From the expansion of life, if the patient's got 10 more years to live, but suffer, it's for the families and friends to watch them and take care of them, not for the patients. And the families and friends to believe that the patients are still alive. Families and friends would have a hard time to watch the patients who's in so much pain, but that's nothing to compare with suffer that patients have. If a patient wants to end his suffer, and doctors think there's no ways to get healed the patient, then doctors can euthanize the patient for no more suffering. In Korea, there was an old lady who was about to die in hospital from cancer. She had no possibilities to get healed and couldn't breathe by herself. But doctors kept treat her and make her breathe with the respirator. She was having a hard time and suffered from cancer, and she couldn't move and talk. And machines wired with her body, and that's the only way to communicate with the doctors and families. She always had a distorted face from suffer and was living with respirator, but when the respirator showed a little change, doctors came and helped her to breathe again. What's the point of that? The guardian wanted her to have no more pain or suffer, so wanted to take off the respirator. And about 2 days later, she died with most peaceful face. All the pain and suffer just ended in that few seconds. Euthanasia is for those kinds of situations which patients are in so much pain or suffer, but they have no possibilities to get healed. And they can move, they can talk, they can eat, they can do anything with themselves. If the country makes the limits of euthanasia is for the patients or guardians to have no more hard times. Treatments and doctors are to make the patients have no suffers or pain. But if the patients are still in pain or suffer, it's useless to do that. Is that right? We got to do what we can do, but we should stop forcing the patients or guardians to have hard times with the hopeless expansion of life. Murder and euthanasia is clearly different. If we limit the use of euthanasia, we have to allow the rights of patients and guardians to be happy. Thank you.